Hi, my name is Emma and I'm an exercise physiologist for University Hospitals of North Midlands Cardiac Rehabilitation Team. This podcast is to help you return or start walking following any cardiac treatment, surgery or diagnosis. Like other forms of moderate activity, regular walking is proven to reduce your risk of chronic illnesses, including heart disease, stroke, asthma, type 2 diabetes, and some types of cancer. It can also improve your mood and reduce your risk of depression. For older people, walking more often is great for increasing general mobility and muscular strength in the lower body, which reduces the risk of falls. For individuals with long-term conditions such as cancer, COPD, heart disease and diabetes, walking can be beneficial to maintain your well-being and independence. It could also help you manage your symptoms of your condition and in some cases improve them. As with most forms of physical activity, walking can have a whole host of benefits for both your physical and mental health. Exercise releases feel-good hormones, and studies have shown it can help improve your mood, reduce stress, manage anxiety, help you sleep better, increase your energy levels, improve your confidence and self-esteem, help you cope with difficult times, and reduce the risk of depression. Physical health benefits include maintaining a healthy weight, keep your muscles and bones healthy, and increase your cardiovascular fitness, to name a few. Walking is a simple, free way of getting more physically active and is ideal for people of all ages and fitness levels. It is easy to build into your daily routine and it does not require any special equipment, apart from a pair of comfortable shoes, of course. Getting started. You can start going out for walks as soon as you feel well enough. This may be within a day or two of getting home from hospital, or it may be a bit longer before you feel able. You must go on how you feel. If you have been prescribed a GTN spray, please make sure you have this spray with you at all times. Start with a short walk, perhaps 10 to 15 minutes at a slow pace. Choose a route on a level ground if possible. If you live on a hill, for the first few days, you could always stick to your house and garden, or get a lift with a friend or family member to somewhere flat. If the walk has caused no problems and you feel well, you can repeat the walk later that day if you wish. Some people may find that breaking the time into smaller chunks is more manageable. For example, walking for 10 minutes 3 times a day, or for 15 minutes twice a day. Build this up over the coming weeks to walk greater distances and potentially pick up to a faster pace. Even a small increase in the amount of walking can bring significant benefits if you are currently inactive. Walking is brilliant for social interaction and reduces isolation. Try walking with a friend or family member for support. Walking with other people provides motivation not to only start walking, but to help walk more frequently and continue this healthy habit for weeks, months and years to come. Distance. Provided you continue to feel well, you should gradually increase the time you spend walking. Please do this at your own rate, as everybody's recovery is different. Additionally, other health problems may limit walking distance, therefore break it down into smaller bouts of walking. For example, 3 lots of 10-minute walks per day. Ideally, we want to build up to walking 30 to 40 minutes per walk. Setting yourself a daily step goal is a brilliant way to maintain walking consistency, using a fitness tracker or pedometer to record the steps. Additionally, the NHS Active 10 app records every minute of walking you do, anonymously. Just pop your phone in your pocket and away you go. The app tracks your steps, helps you set goals, and shows you your achievements. Pace. You may want to increase the intensity of your walk when you start to feel more confident. Make sure you feel well and not uncomfortably short of breath before increasing to a brisker pace. When starting out on a walk, the first 10 to 15 minutes at the beginning should be slower. This is your warm-up phase and very important. After the warm-up phase, you can walk more briskly. Try some intervals. For example, 2 minutes at a brisk pace, then 2 minutes at a slower pace, building up to a 20 to 30 minute walk. Finally, finish your walk at a slower pace for 10 minutes. This is your cooldown phase. This is important to allow the heart rate to reduce and to give your body a chance to recover. Introduce inclines gradually and take them slower to begin with. Increase walking pace when you feel able to. Just an idea, keep a note of the time a certain route took you to complete, and over the weeks you may find it will take you less time. This is a great indication of fitness and recovery. Just a side note, very cold and windy weather can make some people breathless, so wrap up well. You may even choose to exercise indoors on those days. Angina. Some people with heart disease experience angina. Angina is chest pain or constricting discomfort caused by an insufficient blood supply to the heart muscle. Angina can occur with physical exertion or emotional stress. It is relieved within minutes of rest or a dose of the GTN spray. Angina symptoms are always a sign that you should stop exercising. Rest, take your GTN spray. Only resume walking or physical activity at a slower pace when the discomfort has completely gone. Please refer to the GTN protocol for further guidance. Rate of perceived exertion. When going back to any form of physical activity, you may ask yourself, how hard should I be working out? Am I doing enough? Or I don't want to overdo it. A great tool is the Rate of Perceived Exertion Scale, also known as the Rpe Scale. You can find the short video explaining this on our YouTube channel under UHNM Cardiac Rehabilitation Rpe Scale. Another tool is talking. If you are aware of being slightly short of breath but can still talk easily, you are exercising at the right level. This would count as moderate exercise. If you are gasping for breath and cannot talk, you are pushing yourself too hard. You need to slow the pace down. Helpful hints and tips. Remember to always warm up and cool down every time you exercise. Always carry your GTN spray with you. And please seek medical attention from a GP if any time you have frequent angina or a change in angina symptoms, unexpected shortness of breath, dizziness, and palpitations, which is a very fast or missed beat. Always wear comfortable clothing and weather appropriate. For example, wrap up when it's cold to reduce the chance of shortness of breath. Always walk in comfortable shoes that are well fitted. And if needed, walk with a walking aid, for example a walking stick, to reduce the risk of falls. And most of all, have fun and enjoy the great outdoors. If you wish for any further information or guidance about exercise, please contact the University Hospitals of North Midlands Cardiac Rehabilitation Team. Thank you for listening.